Okay, thank you everyone. It's another Friday and we are here again, ready to begin and about to listen to our guest of today. Today we are talking mental health nursing in the United States, and this is coming to you from your one and only vendor of good news. Okay, so today is gonna be a lovely day. I am here and I know that our guest also is here and is ready. So we're going to be dissecting, all the things that you need to know about mental health nursing in the United States. A lot of you, I'm telling you, you will be mental health nurse practitioners when you get here. That profession is booming. So many people are getting into it. Even people that you would never think that they would get into mental health, they are getting into it. I know the reason. I will tell you the reason at the end of the show. So stay put. At the end of the reason, I'll tell you, at the end of the show, I'll tell you why people are getting into mental health nursing. But one of the things I would like you to know is wherever you are in the nursing profession across board, so far you know what you're doing, so far you know your onions, you pay attention to details, you're going to be a great nurse. And one of the major reasons why we have this show is to prepare nurses that are still in their home country or any country where they are, aiming to travel from to the United States, to prepare you, to arm you with the necessary weapons that you need to defeat any kind of challenges that will face you when you come to the United States. So today, I have somebody who has been a great friend. She has also been a colleague. She has been a mother. She has been, I don't know how to, she wears a lot of cap, a lot of hats. I don't know how to, kind of introduce her. There's a lot of things that she does, both for herself. But one of the very things that I love her about is that she can motivate somebody. I mean, she can motivate you to the point that you exceed your limits. You will be looking at yourself, you're jumping the roof, and you're like asking yourself, am I really the one that is doing this? This is the kind of person that she is. And it's not like she's just doing that for the fun of it. She really wants to see people around her succeed. A lot of people who are in some of our groups, when I posted this link, they were saying, yes, we know her, bring her on board. Yay, we want her. So here she is, and I hope you're ready with your questions because she'll be more than happy to answer you. So she's no other person than Miss Ogonna Ugochukwu. Miss Ogonna Ugochukwu, you're welcome to the program today. How are you doing today? I've asked you to unmute. You can unmute your microphone so we can hear you. Yes, thank you. How are you doing today?
I'm doing all right. Thank you very much, Decency, for bringing me here. And I'm happy to be here too.
You're welcome. You're looking so fine and pretty and all that. How is the weather in your place? Are you in Missouri, right?
Yes, I am in Columbia, Missouri.
Oh, okay. How is the weather there? Did you guys have a flood recently?
No.
No.
There are some natural disasters like tornadoes around, but not in my city.
Wow. God will continue to protect you, my sister. Thank you so much for making our time to be here, guys. So it's actually a sacrifice. Many people that I bring here are sacrificing a lot to be on this show. And if I'm asked to pay them, maybe I can't even pay them because I know how much they earn per hour. You understand? And most of them, go from night shift and they come over here. Like her, she may have come from night shift. I think the time I was discussing with her, she mentioned that she's either working night today or she's coming back from night duty today. So we really appreciate the sacrifice of being in our midst today. We're going to try to just go straight to the point and not waste your time. But sometimes the spirit leads and we continue to, have many and multiple discussions. It depends on how we go. So today we are talking mental health nursing, and I just want to give a little background about you. And I think I would like you to do the introduction yourself. So can you tell us a little bit about yourself prior to coming to the United States? Just an overview so that people can understand the background, because a lot of people think that anybody who is in the United States, we just dropped in the United States, that we never had a story behind our journey. So I want you to share just a little story behind your journey before you go to the United States, before we talk about mental health.
Thank you very much, Decency. Thank you for this opportunity to be in this platform. I'm honored to be here, and I appreciate every effort you're making to encourage our colleagues back home in Nigeria and other part of the world. Especially this time they have passed NCLEX and they are in their waiting period. Sometimes it can be discouraging, but whatever it is, the wait is worth it. So I just want to encourage them to that, yes, you're in your waiting period time now, but the time will come when the wait will be over. So that is a word for you. So I want to say my name is Ogonna Ugochukwu. I am a Nigerian, and I've been a nurse in Nigeria before I got to the state for over 20 years before I got here. And I did nursing, did midwifery, and also as a perioperative nurse, as we call it back home. So, and I've been practicing in the operating room back home for about 10 years or more before we got to the United States. And it's not been easy actually back home, but with resilience, with determination, with your vision right there before you, knowing what you want and having the drive that will get you to your destination, you will get there. So that was how we were back home, and we were all looking out for greener pasture for ourselves, for our kids, and then opportunity presented before us. And then we took opportunity by the horn, and then we gave it the best that we could. And right here we are telling the story of good news of what has happened in our lives so far. So I appreciate this opportunity, and I want to encourage you that your turn will come. Thank you very much, Decency.
Amazing, amazing. I just felt like I just listened to a message. We are not trying to be in the pastor side of you today. Okay, but thank you for that. Thank you. So, guys, you heard it from her. She is a Nigerian nurse. She was once in your shoes. She had a waiting period as well. The stories that you hear today concerning people's journey, the same applies to her. But with much patience, she was able to get to the end. And the same thing applies to you. I know that you will get to the end. It's just a matter of time. And the only reason why I'm here is to make your waiting time. I want to make it very productive so that it's not just that you're waiting and it's boring and then everything is falling apart. You can still be gaining grounds while waiting. So that's why I am here today. So, and that's why the program is here. So I just want to ask you, Ms. Ogonna, why mental health nursing? Why, of all specialty, did you, come here and stick and gum yourself to mental health nursing? What is in mental health nursing that is keeping you there? I will come to more questions later on.
Right. So thank you. So mental health nursing is interesting anyway. It is super interesting. Actually, when I got here as an operating room nurse, and I started working in operating room, you know. And as God may have it, everything that happens to us in life, sorry, it's like I'm trying to be kind of motivational about it, but whatever happens to you in life, God is in it for you. So when I came into the United States, it was during the COVID. I came in 2019. And so through the transition programs, and then I started working late 2019. And then it was during the COVID, everybody have to mask up with my accent. I have an accent. We have an accent. Everybody have an accent. So, and I'm proudly Nigerian, and I have no apologies about that. So, with all the masking, closing our nose and our faces, and communication became a thing. It was difficult for them to understand me. And so I was told I don't know how to speak English. That was their excuse. And so they got me off, they relieved me of my job as an operating room nurse, and not knowing to them it's a blessing to me. So they said I cannot work in the operating room in that hospital because I'm not communicating. That is what they say. They got an IELTS professor to interview me, and we talked about English. And after we are done with the interview, and I asked him, I said, "What do you think about me? What do you think? Don't I know how to speak English?" And they said, "It is not about speaking English. It is more to it." I said, "Okay, I'm okay. I just want to know if I'm not speaking or communicating very good." He said, "I communicate, but just I have an accent." I said, "Thank you very much." And that was what happened. That was the beginning of my journey to mental health nursing. And so as somebody who just got to my location, I've been there for up to 1 month and I lost my job. It was a difficult one. So, but thank God who placed so many people in my life in this part of my journey. And so I was encouraged. Somebody say, come over to this facility. They are looking for nurses. So long as you have the certification, you have birth certification, and you have the license for the state, that you are very welcome to come. And so that was how I moved. And then I went. It was not easy. I had to drive about 2 hours to get to this location. I get an interview done that day, and I was given an appointment. So I started the background checks and all of that. So that is how I find myself in mental health. And ever since then, I have no regrets. I am happy being a mental health nurse in every way. I am happy. I am making progress in it. There are so many ways, so many things in it for you. When you come, you look and you see whatever you want to fit in, mental health wise, in this career, you will find your niche there, and you pitch your tent there. So that is how I entered into mental health nursing, unprepared, unaware. I never knew that. And so that was how I got here. And I am happy that I'm here and I'm enjoying it. Thank you.
It's a blessing. Thank you for sharing. Thank you for sharing that experience. And this same thing goes to everyone who is here. First of all, there's something I skipped from the beginning when you mentioned that you spent over 20 years working as a nurse in Nigeria. Somebody was in the comment section saying, wow, what a true legend you are. 20, years is awesome. And that is a word for somebody. A lot of people come to my DM and say, I think I'm too old to go to the US. I think this program is not for me. She spent 20 good years working as a nurse in Nigeria before coming over here. You understand? She's young, but I also have in my radar a lot of people who were in their 50s, close to 60 before they came to the United States, and they are doing marvelously well. You understand? So age is not your barrier. Don't just go and relax because you feel, oh, age and that and all that. Then you also see how a dogged fighter she is. Some people will lose their job and they'll be devastated, but she lost her job and she picked up her pieces and then went back and got another job. This also telling somebody, even though you come over here, be open-minded. If anything happens, do not back down. Do not back down. The only person who is defeated is the person who have chosen to be defeated. If you are still standing, if you still have your license, you can still progress and become even the head of nursing in another hospital. It can grow to the leadership level, So just have that in back of your mind while we continue to discuss about mental health nursing. So now I just want you to take your time. It might take you 15 minutes. It might take you 30 minutes. Some people take more than that when they explain. But I want you to explain to everybody who is in this program today, from the time that you clock in at work to the time that you clock out at work. Tell us step by step all the responsibilities that you perform as a mental health nurse.
All right. Okay, thank you. So I want to say, you as a mental health nurse, you can work in different kind of institutions. So depending on where you are working and what the policy or the staffing need is in the place, determines what you do. I am a night shift person. I am a night shift nurse, and yes, I do. I'm flexible. I can work any shift, but night shift is meant for me. It's my thing. So I want to say that mental health nursing, you can practice in acute setting. You can practice in a lockdown facility, and then you can practice in correctional. So we call it correctional here. Back home, we call it prisons. You can also practice in a forensic, centers. So what I'm trying to say is, depending on where you are and what, I started working in a locked-in facility, in a forensic locked-in facility. So here in the United States, when I started, I started my move to mental health. And that day we came in and we were talking, we were doing orientation and we were talking about mental health. And I discovered that when back home, when you take mental health, we just talk about, psychiatric, we talk about, mental health condition and all of that. It is beyond that in the United States. So in the United States, they in a way, they relate some crimes to mental health. And some people take advantage of that in the system. Some people will commit crime and they tell you that they are not mentally stable. They will tell you they were depressed. They will tell you one story after another. And then their lawyers may, work with them to make sure they were incompetent. They were not in their right senses when they committed the crime. And so that they will now, this is crime-related mental health issues. And so in forensic setting, over here, the majority of the clients of the patients you see are those that committed crime. So you call it either forensic center, and most of them are locked in. They are like prison, but they are not in prison because they have some access to things that those that are in prison do not have. Then in the correctional settings, there you will see those that they are already like they've been judged, they've been sentenced. Majority of them are there, right there in prison. But those in forensic, they can have opportunity to get better because they are incompetent. And then from there, they go from maximum to intermediate, from intermediate to lower security, whereby they can still have the opportunity to interact with the society, but they will get back to that. So I don't want to bore us with all of this, but I just want us to know that there are so many levels to mental health nursing in the United States. So, and I have been privileged to work in these settings. I've worked correctional, I have worked forensic center, I have worked acute, and that is it. So I will just say one or two about day shift, and then I will now concentrate on my area as a night shift nurse. And so depending on the hospital where you are working, I have worked some hospitals whereby they do ratio, nurse to patient ratio. They can give you 8 patients, you have 8 patients in your care. As a night shift nurse, when you come in, first of all, you get report. They give you a report of what happened during the day, if there be admissions. They give you the report of the new admissions you have in your unit. And then if you are expecting any admissions, also they will give you a report on those that are coming in. And then after you have taken report, for those, for the facility whereby the supervisor or the lead nurse, which we do sharing, they will now give you your patients from this patient. So those that did morning shift, somebody have the same number of patients, and then you go straight meet the nurse that had them during the day shift, and then get report from them. Some people will just do general reporting, So depending on where you work. So if I am working in a facility whereby you have 8 nurses and somebody had them in the morning, you meet the same nurse, and then the same nurse gives you a report about these 8 patients. And when you have taken report on these patients, you go right ahead to pull their medications, open your system, look at the medications the person have for the night, and then you pull the medication from access center or from the Omnicell or whatever. Everybody calls their own thing differently. So you pull your medications from there and get it ready to go see your patient. And then you go see them. In seeing them, you are assessing them, you are talking with them. And for mental health key things, you ask this patient, how are you doing today? Ask him, are you any anxiety, any depression, any pain? Ask about bowel movement, because some of the medications they take, they cause constipation. So you have to ensure every shift that you are asking and making sure that these patients are moving their bowels every day to avoid them being constipated. And if you overlook that, it can bring different kind of complications to them. Some of them will have intestinal obstruction because they were not having a bowel movement. So you ask these 5, 6 key questions every shift. And then as you're talking to them, you're assessing them, you're seeing their behavior, how are they doing, are they withdrawn, are they emotional? You'll be able to, from there, know what's going on. If this patient is the patient you've known before, has been somebody who is outgoing, talks, and now is not talking, be able to know that something is going on. So you ask this basic question in course of assessing the patient, then you give them their medications, listen to them if they have any need. In the night, most nights we don't have programs running at night, to keep them busy. They just take their medications, interact with you, watch televisions, and if they have any other thing you need to discuss with them, you go right ahead and do that with them, and then you let them go to bed. And so this is when you are in a setting whereby they do maybe 8 patients to a nurse, and then you now sit in and do your documentations, everything you have heard from the patient, what you have observed. You do your documentation and then get the unit ready to to give report to the next shift, that is the morning shift. Then, but this is for this kind of facility. Then if you are in a locked-in facility, I am giving an example where I have worked. Sometimes you have like 50 patients to your care to one person. You have like I have had 75 to my care. So don't freak out. Don't freak out. Like I would say, locked-in facility, mental health is good. You know why? These people are hell and hearty. They are not sick. Like they are not having abdominal. They don't have any medical issue. They don't have surgical. Yes, though very few may have. So I'm just trying to say, it's not really like acute nursing whereby you do bedpan thing, bed wash, bedside. Oh, a lot of you don't do all of those in mental health, depending on the unit. We have children unit, we have adult, we have the geriatrics, that is the seniors. So you have depending on that. So yes, in a locked-in facility, you can have 50, 75 in your care. And then you have people working with you, have the psychiatric techs working with you. In this locked-in facility, like I was talking about, where you have about 50 patients in your care, you can have up to 6 to 7 techs working with you. And then you can have also an LPN who passes your med, or you have an RM2 who passes your med. That is in a locked-in facility. So you have them in your care. And basically, because they are healthy people, physically, not mentally, they are healthy physically, they are not demanding. You may have 1, 2, 3, 4 people that are, that are really tension seeking that you look out for, or people who are really have issues that you have to look out for. Some of them, sometimes when they are either so aggressive or they harm themselves, they have to have support. You have to have either 1-to-1 or 2-to-1, depending on the patient's situation. And so these are the people that you focus on after you have passed medication generally to everybody. Then you look out to them, you talk to them, you interact with them. And then these ones will be able to give reports, but not on all the 50 or 70 patients as the case may be. Some people will be saying, how do you do that? Honestly, mental health nursing is experience that you would like to have. When you come to this state and you see situation, it's some of them, sometimes you'll be like, reality will dawn on you. So many things that we take for granted back home, it's a crime here. And you see young people who go through a lot, who don't see any hope to be alive. They can no longer be free and live a normal life because of situations around them. So what am I trying to say? Yes, you can nurse up to, like, you have about 70 to 75 in your care. You have an LPN or a registered nurse working with you. You have other techs, about 6 to 7 of them, who runs around taking care of this patient, making sure they are maintaining boundaries. They are, they have the limit to things they do. So this is another aspect. And then you have in the correctional, you also have different settings. Some of them work in the infirmary and all of that. So this is night shift for you. On day shift, I know they come into, they get report. And then I have tried day shift before. I said, let me just try and see how it is. So day shift, the same thing, you get a report on your patient and go through the report and see what is needed. Anybody who needs labs draw, you make sure they are calling the labs to make sure they are around to, to draw labs on these ones. Then you start your group meetings after you must have passed med. You do your assessment. One person after another. After you have done your assessment, then there are group meetings, different kind of activities. We have activity therapists that will come in and do 1 or 2 things with them. We have music class whereby they come in and play music with them. They dance, they discuss it. We have social work. They come in discussing different topics with them. Sometimes They discuss different things, and some of them get emotional depending on what topic is being discussed. So they have different groups, different meetings, treatment team, whereby the doctors, the nurses, social workers come together to discuss patient and their situation and way forward, and those who are doing better, and then now you plan discharge. This is for day shift. So what am I trying to say? Mental health nursing, yes, it may not be easy, especially it drains you. You have to, if you have the passion, you give your everything to it. It may be draining, but it's very rewarding. So I want to say, yes, having those time with them, before you know it is all gone. The day is gone, the night is fast spent, and they go to bed. So I want to say that, yes, it may seem very, very, very like stressful or demanding, but I'm telling you, it is what it is satisfying. Thank you very much. Let's stop here.
Marathon. Thank you so much. Thank you so much. I dropped a question on the comment section, so I like to hear from you guys. I know some people have different preferences. So, what shift would you like to work when you come to the United States? I know you said you like night shift, and we just after maybe when we get responses from the comment section, we will find out. From you why you kind of chose night shift as your preferred shift. All right, so I think you have a lot of people that agree with you on the call today. So many people are saying that it's night shift that they would like to work when they come over here. And our guest also said it's night shift as well. So just three people. I want more responses. I really want to know what kind of shift you would like to do when you come over here, because I would have something to say at the end. I feel like there's some shift that just doesn't give you a good time to learn. Morning shifts and day shifts, or second shift as they call it, might be kind of very fast paced for some people, depending if you're just coming here for the first time, and you really want to, unless you have had a very good, you have had like a very good, start in another hospital where you are very, very comfortable doing a day shift. But, it depends. Some people like night shift, like, day, depends. Some people do afternoon, like 2 p to 11 p, depends on what works for you. But there is always, opportunity for you to kind of explore here. Now, let me ask you again. I know you did justice to that question. There are some questions on the comment section. People were asking, did you have to go through any kind of study before you became a mental health nurse, or did you just apply and get the job? Did you go through any kind of study before you started working at the place where you're working now?
Okay, thank you. I did not. Like I said, I lost my job, and then you have to you have to pay your bills. So I did not, like, there was no time to do all of that. So in United States is a place to be. I always tell people, yeah, I am happy I am here. Super, super happy and grateful to God. And every instrument that He used to bring me here, I am super happy and grateful to them. You don't have to, so long as you are a nurse. Yes, there are key areas in nursing in the United States that need your certification, of you to be certified or have written one or two exams in that area for you to work. But mental health is not part of it. I have not really, yes, I have done some extra studies in the States, but I've not really done any that is mental health related. Yes, I've been certified, but I have not really like did any extra. I just came in and did interview. You are a general health, you are a general nurse, yes. You have the state board, you are state board certified. Yes, I am. And then they did an interview. Then they asked you general, if you are a nurse, you have you've been nursing any part of the world, just critical questions. They ask you questions. Yes, you are in facility and your patient gets aggressive or whatever. What will you do? They just want to know what you do. They just want to, it's just a critical thinking thing. So you don't have to do any special study or whatever before you can work in a mental health. As per entry level, you don't have to.
All right, thank you so much. Yeah, let me just add. Thank you, Stephanie. She was adding something on the comment section. She said day shift is better when you have gotten your ground, like when you have adjusted in the United States, then you can go or switch over to day shift. But I just wanted to add, you're very right, Stephanie. But a lot of people, someone was sending me an email in the comments say how many hours sleep can one get on night shift? There's no hour sleep in night shift. So if you cannot do without sleeping in night when you're on night shift, then don't go for night shift. Just go to your day and just do it there. Go for your day shift and do it there. Whatever you find, you take. Because a lot of people lose their license when they are caught sleeping and patient, had an issue. Can you imagine if your patient just coded and you're just sleeping and they finish all the code, finish everything, and you did not even come there. Maybe the patient even died. They packed the patient and took the patient away. You now woke up and go to your room and say, "Where's my patient? Where's my patient?" Everybody will just be looking at you like you have gotten your sack letter immediately. So just make sure night shift, there is no sleep. When you come back, you can just go to bed, kill yourself with sleep. But when you go to work, it is work. You're not paid to come and sleep, you're paid to come and work. Even when there is no work. That's why I like this the whites. What one thing they know how to do is how to be busy doing nothing. Sometimes I find them at work when you go to work. A lot of people, they just be walking up and down. If you stop one and say, "Where are you going?" There's nowhere. They just want to keep themselves busy. And most times they take coffee, and coffee gives them so much energy, and they can't just stay one place. They just be pacing here and there, but that's not the topic for today. Now, you said something, Ms. Ogonna. You said something about someone being aggressive. And I just wanted to ask. I know that there's been situations where patients, attacked nurses, especially those that work in mental health home. And this is one of the major challenges why a lot of people do not fancy going to the mental health home because of being attacked. So how do you deal with aggression? How do you deal with people, trying to come and, slap you or, just make advances at you? Depends, there's a lot of things that go wrong when you work with mental health home. So how do you deal with all that?
Right, thank you. So, and so when you get started, like this week, on Tuesday, I went to a training. They call it SMART training. So, and trauma care and SMART training. SMART training, whereby they teach you how to de-escalate a patient who is like, aggressive, going, and then what do you do? How do you come in? You work as a team. So when you have aggressive patient, there are, so like when I was working in the locked-in facility, there are programs. The program one particular program I worked for 1 year. This program is just for a group of people who are like not mentally delayed. They are mentally delayed or underdeveloped, and so they don't think like us. They are autistic, and they are very like, well, they have ADHD, and then so they are easily like out there, they lose it quickly. So one good thing about mental health is you are being sensitive of your environment, knowing this patient, knowing what they can do. If you nurse them like the locked-in facility, you work there. Like I said, I worked there for 1 year, and I have known, you know them, you learn your patients, you know their mood, you know how to interact with them, you know their weak points, you know their strengths, knowing like everything about this patient, so that you know how to come in, how to help, how when situations, when aggression, or when they get aggressive, or when they want to lose it, what will you do? So in situations like this, already you have techs on the floor who are like direct care, working with them already, talking to them, and then trying to do their part until they get to a point. The only when they not, that is one good aspect of, only when you get in is when the techs working with you, the technicians working with you, they have tried to do their bit, and this patient is not trying to get redirected. Then they will now either call a code whereby the nurse, it's not just you make once the code is called in a mental health setting, everybody that are not there expected to respond, even at some of their during the day, during the administrative staff are also encouraged or mandated to respond to codes. And so once the code is called, you're not just there by yourself. So staffing is key in mental health because you need a lot of support when your patient goes off. There are so many things you cannot do. We do hands-on. And so, but you have to get the training because we have cameras everywhere. The way you handle this patient, the way you take care of them, how forceful you are, it's also what they look out for. So once this patient becomes aggressive, and then the staff may call you without calling a code, and then you come and see, hey, what's going on? Can we talk about, so if the patient is just pacing around, is just becoming aggressive and is walking and is talking, you can stand a distance and begin to talk to this patient. Hey, what's going on? Do you want to talk about it? And things like that. So from your interaction, from afar, the texts are there. You cannot go meet a patient without going with your text. Your texts are positioned strategically with you to either defend you and also defend the patient. And so that is what it is. So you go there with your text and you talk to this patient, and you see some of them, once you start talking to them and being reasonable, that is where passion comes in. You don't treat them because they are sick. They feel, yes, already they are in that situation, knowing their fate, that they don't have any future before them. And so when you want to treat them also like they feel they are being treated like crap, they get it, they'll go off with you. But then when they see you that you are very understanding, reasonable, you want to listen to them. Some of them felt that they are not listened to. We say, "Come, let's talk about it. I'm here to listen to you. Whatever it is, let's talk about it. And then I will see here how I can help. If you want to talk to me or you have someone you want to talk to right here, we can get the person for you to talk to the person. If you want to get the attention of the doctor, whatever it is, talk to me, and then we take it one step on the go, one step at a time. If it is what I cannot do, I will call the person that can do it. If it is not what we can do tonight, because this is night shift, everybody has gone home, I will make sure." So what I'm trying to say is your approach to these people. They are human beings like you. You put yourself in their position, in their shoes, and you talk to them. I'm telling you, they listen in most situations. But when you get to the point whereby this person is not listening and is becoming a harm to himself or herself or to others, then we do hands-on. We do manual hold, we hold them manually. And depending on how the person, continues. Some people, once you hold them manually, they keep fighting. And then you move to the next level of intervention. And so that is how you go in deciding to either you give a shot or you're going to put the person on restraint or seclusion, as the case may be. So it is as you interact that will determine the next step. So as in because of the escalation, determine the extent of which you can go to restrain the patient, especially when it becomes a danger to self and others around him. Thank you.
Oh, thank you so much. Thank you. I hope we are getting value for all the information you're hearing here today. You're hearing about codes, you're hearing about text. Some people think text is technology. It's not technology, it's human being, right? Am I correct? Text
Yeah,
are
of
human
course.
being, right?
Yeah, human beings.
Because the
Yes,
way
human
you say text,
technicians.
some people might just easily think they're talking about technology. No, we're talking about human beings that have been trained to work in such departments. So if you're really getting value for being here today, I would like you to type value on the comment section. Type value for me on the comment section. You have 1 minute to do it. 1 minute. Value, value, value. I want to see almost 100 values. We're almost 100 here. So I want to see 100 values on the comment section. Thank you. If you are getting value, I want to see you type value on the comment section. Thank you, thank you, thank you. Keep it coming, keep it coming. Yes, yes, thank you. Thank you so much. We are all learning. We are getting value for being here. Yes. Thank you, everyone. Value. Thank you, Debbie. I like that. Value plus, 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 plus. Thank you, thank you, thank you. All right. Okay. Good, good. Amazing. Now we have woken everybody up. Now let's discuss about codes. You said something about code. I know some people will not understand what code means. Is it a secret lock that somebody will go into, or are there different kinds of code that we need to, learn about your job? what are the types of code? And when you call it, can you, even if you can demonstrate it for us? Because one of the things that we do here, we are trying to imagine, we are building imaginary picture of how our US journey is going to be. So if you can not really like getting up to demonstrate, just say whatever they say during your code and then tell us how the response, normally come.
All right. So yeah, basically in hospitals, in schools, there are codes that, so when you call a code, is where like you are creating an alert. So whether it's red or blue or white or gray or pink, all of these codings, they represent different things. So in mental health, everybody call it different things. In a locked-in facility, or like in the correctional, they have a number they call code. Once whatever number they call, they know that this somebody is becoming aggressive. You need to run in that direction. So everybody gets his own, but the regular codings we know. So in a locking facility where I've worked, they call it staff support. It is a code. It is a code. Once they say staff support, so we have in our keys, we have keys. The mental health, you have keys that give you access because everywhere is locked. As you pass by, you lock. As you pass, you lock. So you have on your key, you have a sensor thing on your key. Everybody has it wherever you are, even outside that campus, you have that. And so once that sensor is pressed, it will now it sets off the code. There is staff support on so area or so unit, and once that thing is in, it goes to the central unit, maybe this where the security are, and they will announce it, echo it wherever the code is, because there is staff support on so unit, and everybody starts running wherever you are. And so they call the first one. When they call the first, everybody, those that are available goes. And then if there is a repeat, that is, they are calling for reinforcement. It's getting like seriously serious. They don't have enough staff on ground to help. They call for second one, available staff in the building, wherever you are, start running towards that end to help the situation. So then in the hospital setting or acute setting, we have code gray. Like where I work now, we call code gray. Code gray is for aggressive situation whereby you need to intervene. Either the patient is attacking a staff or attacking a patient, or they are fighting, or they needed an intervention to happen. And looking around, maybe you have 2-3 people, and the way this patient is going, 2 people cannot deal with the situation. And if you go ahead and start intervention, there may be more people getting hurt, or people will go out as a result of being hurt, and they will be sent to the hospital. And so staffing is a thing in the state. There are short staff. That is why they are looking for us. That is why they are needing us. They are short staff. And so you, as a nurse who in charge of a unit, you have to be careful so that you won't lose more staff by not having enough people on ground before you start intervention. And so you call. Sometimes we call silent assist, whereby you don't need to announce over the speaker that you need help. If it's somebody you look and you don't have enough male technicians on your unit, you can quickly call different units. Please, I need some reinforcement. Just quietly. Can I get 5, 6, 7 men? I don't need women, depending on the situation. And quietly, you send that message across, and then quietly they come. The patient will not be aware that, help are coming for you. And because some of them are super smart, they are smarter than you are. They will watch the situation and don't want to do what they want to do. And so they don't know you are now quietly calling assistance around. And then you call that, and quickly people will just, before you know it, people are right here around you. And then you'll be able to instruct them, and then you do what you want to do. So, but when there is need and they're already in it, acting out, then you call. So that is called gray. When you call code gray, anybody, anywhere anybody is, everybody is mandated. If you don't attend to codes, you get into trouble. So once we call code gray, wherever I am, whether I am eating or not, I put away my food and I start running towards where the code is needed. We also have code pink. Code pink is when you have health situations, like this is psychiatry or mental health institution, but you can have People can have seizures. People can be bleeding from the nose. Somebody can fall, hit his head or hit somewhere. So when situations like that happen, anybody who sees that first called a code pink. And so you are running as a nurse. Once you hear a code pink, you're running with your vital signs machine, you're running towards that point, and some people will grab the crash cart, whereby you have everything you need in a nutshell for you to give like a first aid treatment to this patient. So we have code gray, we have code pink, we have code blue. Code blue are like you've got everybody, wherever you, every medical person in the building, the doctors, the nurses, if the pharmacist is around, everybody starts running because it's a medical situation whereby either a patient, the respiration is compromised or the vital signs, either of them is being compromised. And so once you call code blue, you know that it is an emergency. Ambulance may be needed. Once you come and assess the situation, you call 911. The ambulance gets there because there is possibility that this patient is going to be sent out to the hospital. It's not something you can, go ahead and start giving emergency care. You quickly call the ambulance, try to do basic foundation things, basic first aid things, and then the person goes. Or immediately before everybody gets there, somebody is calling an ambulance. Ambulance is already there, and they are good to go. Respiration is compromised, or any part of the vital signs is being compromised. This patient goes. So basically, what we do is code gray, code pink, code blue, sometimes code red. It's not just that related. Or sometimes we call code black. If you are maybe went to the parking lot and somebody attacks you, something mental health, it can be it can be dangerous too. If you don't have a good, like, your patients can be discharged and they go back and reinforce and come back and wait for you at the parking lot. And so you call code black. And then people will call the police for you, and everybody gets there. So basically we call 4 or 5 codes. Code gray is our friend, code pink, code blue, code black, and code red, as the case may be. Thank you.
Wow, wow, that's great. Thank you so much. Thank you for that insight. I hope you guys are learning, guys. I hope you are learning. You're learning the terminologies that they use in their unit. I hope you're learning. Thank you so much. So every week, I started doing something. I think it started last 3 weeks or last 4 weeks. So I always give like a live scenario of something that happened in the hospital. And then I always look for, and this is just, I'm doing it so I can give my guest a little time to breathe, so that I can talk for some time. So now we've learned all the codes, but this one, I'm just going to narrate a scenario and then ask you what you would do. So a lady that, I talked to someone that know her directly. So she was fired from her job because she was talking to a patient and they got along very, very well. She and the patient, they got along so well. So the lady went on a brief vacation or something like maybe off, something like 3 days. And before the lady can come back, sorry, it's the other way around. The guy, the nurse is a guy. Okay, the patient is a lady. So the patient, the lady, the guy went on a vacation, and before he could come back, that's the off. The way you work 3 days or 4 days, you get 2 days off. Before he could come back, the patient has gone home. But they really talked, they were very close. The guy is single, the lady is single. So the guy now went to patient medical record, where they put all the patient information. There will be a place where you put the patient's phone number, and then went there and collected the patient's phone number and called the patient and started introducing himself and all that. So my question to you today is, if you are in that kind of scenario, in that situation, would you do the same? Would you get that number at all costs to call the patient and start introducing yourself, being that the patient has gone, but you guys have something going from the hospital? What is your answer? What would you do? How will you reconnect to your crush, your patient crush? I am waiting for answer. Yes, somebody says it's a no-go area. Okay. So how will you get connected to your crush now? You have to, for some reason, you have everything has gone, a patient has gone, there's no way to communicate again. The only ground to communicate is in the hospital, and you came back from night duty off, and the patient is no longer there. You understand? What will you do? Please don't hide. Don't just be yourself. I'm not going to mention your name. Be yourself. Just say what you can do, what you're going to do, and be very, very honest about it. Some of you are lying. You're just saying it's no, 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 no. But you know that for some reason, if it's you, you will try to advance and go further. All right. So someone says all shades of wrong. Yes. Someone said it's unethical. Yes. And someone said, I can never crush on my patients. Haha. Ha. I hope you're single though. All right. Let's see what other people are saying. Someone said it's unethical. Someone said crushing on clients. Nope. And then there's a lot of responses. And I would really like to get some of your responses because this is a life, is something that happened recently here in the United States to someone that I know knows the person. I was telling me the audio. I was like, wow, this is something that I need to tell all my people. So someone said it's a no. Someone said termination phase. Yes, yes. Thank you, Emmanuel Obonna. Yeah, termination phase. Yeah, I don't think that's acceptable there. I will let it go. It will not, it was not meant to be. Now, if you're in your home country, would you do it? If you're in your home country where you are now, Kenya, Ghana, Nigeria, would you do the same? I'm asking you, I'm just asking. If you're in your home country, would you look for the number and call? You understand? This is a secondary question. All right. So I see someone that's saying, I don't think that's acceptable. Okay, it's unethical. I know they do that kind of thing. Our relationship don't end for hospital. All right. So whom is costly? America, no be Nigeria. Yes. No crushing. Yes. And if she cares, she will get across. Yes. Relationship between patient and nurse should be professional. Even here, I don't give my patient my number. Yes. Good. And someone said if he's in Nigeria, yes. Someone said I like people being frank, being honest. If it's in Nigeria, some people would do it. Yes, I see some other responses. No, no, and yes, if it's in Nigeria. Okay, all right. So I'm just putting it out there. So the guy was sacked. The guy was sacked from his job because of this singular incident of going into the medical record, getting the number from the medical record and calling. You know the reason why? Because the girl was not interested. So when the guy called, the girl reported to the hospital and said, I did not give this guy my number. I know must have gotten it from my patient information. That's patient health information. PHI is something that they guard it very, very well. So anything that violates the law of PHI in the hospital, that thing is taken very seriously. So I'm just putting it out there for all of my peeps. When you come over here, you have some privileged information, which is going to be your patient's information. They are privileged. They should only be used for professional practice only. Do not use PHI for any other reason. Do not use that PHI for any other reason. I'm not going to mention the nationality of that guy. And also to let you know, that guy that I'm talking about is actually on contract with an agency. The guy is on contract with an agency, so he was fired, and the agency had to start looking for a job for that person again. So please, please, please be careful not to divulge or violate PHI laws in the United States. Now that we have talked about PHI documentation and all that, let me ask our guests today. So how do you document when in your facility? Medical record, how do you handle medical records, your documentation and all that? How do you document, ma?
Okay. So so what do you like? Yeah, we do it is an e-medical record. We do EMA.
Okay.
Give me a second. Give me a second, sorry.
So, all right. So there's a lot of responses that I've seen. Someone said, yes, in my country it can be done, but in the States, that's in the United States, no. And then someone else said, yes, we can do it in Nigeria. People should leave our Nigeria alone. There must be a law that says you can't do that, just that it's not being enforced. Okay, yes, someone from Kenya. Yeah, yes. I know that some people is gonna go against it. So in Kenya is against nursing professionalism, and one shouldn't accept even gift. Even gift you cannot accept. I know some of the people that work in big hospitals in Abuja, that's one of the things. Sometimes you collect gifts that is even 10 times more than your monthly salary. So even gifts should not be accepted from patients. Okay. Well, because once you start accepting gifts, it will make you to start giving preferential treatment. You come in the morning, you boil water for them. You even go and do jobs that are not nursing related. You can wash their cars, you can go and do many things, just because you know that that's where your source of, next meal is coming from. So please, please, this is actually not, it's not ethical. That's just the word. It's not ethical. So in Kenya, it's not done. And someone said, see village people. Yes, actually, yes. So I have someone again that is saying, is it possible to have feelings? Is possible to have feelings for your patient, but it's unethical to take their number from the hospital system and call them after they are discharged. Wait patiently for nature to bring you guys together outside hospital nurse relationship. Thank you so much. Thank you for arranging those words in a very, very good way. I like that. So someone said Poppy Act. I don't know what Poppy Act means, but if you can throw more light on Poppy Act, I would like to learn. All right. So back to our guest. How do
Thank
you
you.
do medical records? How do you handle medical records in your unit, ma'am?
All right. So medical records, yeah, we have you have different kinds of I don't know if you're talking about charting system or medical
Yeah, the
records.
charting system that you use, do you document by hand? Do you use Epic? Do you use Senna? All those kind of things.
Okay, yeah. So I have used Epic, and in a locked-in facility where I work in, it's a state facility. We do Metacare, META care, Metacare. That is what the kind of you know ER medical records we are using there. And over where I'm working now, we are using WellSky. These are different, documenting systems. But basically, um, like what you are talking about, we are not supposed to share patients' information. You are not, if you don't have any business with this patient, you don't go there. You don't have any need for that. Social work, they have a lot to do with extra, call it anything extra after the hospital life. Outside the hospital life is social worker. He goes the one that look for those that are homeless. He's a social worker that looks around, for accommodation for them. They are the ones that have keep in touch with the family. Yes, in as much as you're a nurse, yes, you can talk to the either their family members who the patient. We have what they call release of information form. This patient, an adult patient, let me just go there. An adult patient will say, I don't want my information released to my father, to my mother, to my this. They will have one, two, or limited people they want their anything about them. Some will say, yes, this person, somebody is in my release of information for, but there are limits to what you discuss. They will tell you, you can discuss this with this person, you can discuss this, but you don't discuss this, and this. So this is medical record. So they tell you what and what. So, and you don't have any business with that. You are not seeing a patient face the information that is related to your care, the care you are giving to this patient. Every other thing is no business of yours. So you do your documentations, you type. We don't do paper chatting. Unless whereby either there is unprecedented situation whereby they did not plan it and there is a system is shut down, or they know there will be a long time whereby there will be a system will be down, and at that point in time they have to document. So once they are aware that it's going to happen, they will tell them. We are on night shift. They will tell us this is going to happen. Sometimes it's happened between midnight and say 4 a.m. And so if you're have anything to do, you are going to pass medication around that period, we print out paper charts whereby you can see the patient's prescription on paper, and also when if you have PRNs, you are given that. If you have medications as need be, then you have to look at those paper and chart whatever you do. Also document. Yeah, there are forms whereby you can document if the system is down. So we don't, on a good day, do paper charting. No, not anymore. And then, but on a good day, we do like normal charting using different types of charting system or ER medical records that is available to that facility. It's about typing. I'm telling you, it is like we said before, night shift is a place to start. If it is conducive for with your own family situation, you'll be able to, it's a low pay, you can just sit down, learn things, unlike the day shift where everything is go, 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 go. So we'll be able to learn. So charting system is we type. We type in the computer, we don't do paper charting in some places. Yes.
Okay. All right, thank you so much. Thank you. And then also to back that story up, I just remember that there is an NCLEX question I used to see where the unit secretary will come to the nurse and say, the patient is in bed 201, is my neighbor. What is wrong with the patient? And what would the nurse do? Would you tell them? Will you tell because he's a unit secretary, you will tell the unit secretary everything or not? And you know the answers are always going to favor those that said, no, this is patient health information. I will not disclose it. Okay, so always be careful and always be mindful of that. All right, so it's time to open up the phone lines so that you guys can ask your questions. I've asked our guests a lot of questions today. So it's time to open up the phone lines so that you can ask your questions. So guys, I want you to use the reaction button and raise your hand if you have a question to ask our guests, and I will let you speak to our guests directly and ask your question. While you're thinking about it, I just want to mention some people are sending you some special greetings. It's just that there is no name to the number, but someone is saying, sending my special greeting to our guests. It feels really good to hear from you, Ma. Thank you so much. You got a lot of fun.
Thank
If,
you.
if you go for a presidential election in my Zoom, you will win. Is there an
Thank you.
extra pay for mental health nurse? So someone is also asking, do they pay mental health nurses more? Do they get more pay? Mental health nurses.
I would say so. It depends on where you are. Staffing is key. They can do any facility, depending on the fund that is available to them, can do anything to get people to come to work. They can do anything. They can give. They can do bonuses if you come in for so shift, depending on how short they're on the shift. They can say, okay, if some people, yeah, they can say if you come in for this 4 hour shift, they're going to give you extra $500 like that, so that people can pick up those shifts. So when they are short, they are short. They are doing everything possible to fill in, their staffing need. And so they can put it out things, they can say, we can give you extra, so. And we have like, so, sorry, where I work now, their weekends, it is hard to fill the weekend. And so we have what we call weekend program. I do weekend program because there are extra money attached to weekend program. And so if you're doing, we say, okay, we can give you extra $8 per hour doing weekend program. Weekend is Friday, Saturday, Sunday. So they do that. And some people work just weekend because there are that special incentive attached. And so they can also offer bonuses. So different ways, depending on where you are, these different states, different things, different things. Yeah, some people, the only one good thing, one good thing here is that they start counting our years of experience from back home. So as I am right now, I work as a unit charge nurse in my unit, and then they put everything together, your experiences from back home. They put it together, and then they place you on a pay that is commensurate to your year of experience. So that is key thing I know. So differently from different states, they do different things just to attract staff to come and work with them. Yes.
Right. All right, thank you so much. Okay, I'm still waiting for your questions, guys. You can use the microphone and ask your question if you wish. Okay, but I have some questions on the comment section. Somebody is saying, how do you navigate night duty as a nursing mother? How do you navigate night duty as a nursing mother? I know you are not a nursing mother in the US, but
Uh,
if you can attempt the question, yes, that would be good.
Okay, so I want to say, like I said before, everything is about family situation. Like Decency said, I was fortunate. I was not having kids when I got here. So it was way easier for me to do night shift. And then, but mental health nursing, I always talk to people that, comes into the state. If your family situation we allow you, mental health nursing is good for you. Why I'm saying this is it is not stressful. Whether day shift or night, it is not as stressful as it is when you are either in med surg, or there are some of them that are so physically demanding. But in mental health, like I said, you have technicians that work with you. This some people in message will say we don't have enough people to assist. You don't, you see yourself going in between to be the one to do the things that we are not supposed to do. So, but here you have people available to you. Mental health nursing, if it is mentally okay for you, because some people cannot handle some things mentally, either because of what they have been through or not. But if it is something you can handle, it is not stressful. You interact with this patient, give them their medication, talk to them, do some side things, in that dance with them. I work with the seniors, so sometimes I dance with them, we dance and we laugh, and then they go to bed. You take care of them in that way, and you're out and you have all the time. Either you go to school, if do your online studies, or do your other stuff you need to do that is allowable in that facility. So I want to say that for a nursing mother, if you come into the state, I don't know who the person asking this question, if you're a guy or a lady. If you are a lady and you are still in your nursing, it is good for you. Because by the time you are done, even if you're doing 12-hour shift, you'll go home. You will not be so passed out that you will not attend to your kids. So if you have your husband or somebody who will take care of the kids for you, both ways. If you are doing day shift, you have to have somebody be there with them during the day as you go to work. Then you come back and take over from that person. If you're working night shift, you have to have somebody who will be with the kids, because they don't play games with kids back home. Your neighbor, your next door neighbor that will smile with you and say hi to you and say, how are you doing? Will be the one to report you that you left your kids and went to work. And so that's what I'm saying. Either way, if you have support, if you just get into the state together with your husband and you plan your family and say, okay, I'll do day shift while my husband do night shift. And then maybe you have space in between. Maybe you are doing, if your husband is doing from 7 p.m. till the morning, you might decide to do 8 hours shift. You work in the morning till 3 or 4 p.m., whereby you come back and be able to transition with your husband and everything. He will take some rest before he goes to night shift. So either way, as a nursing mother, it is good. Yes, in facilities they have a nursing mothers room where if you are still breastfeeding, they call it a breastfeeding room, whereby you can express milk. Some people store you express milk and store it somewhere that when you get home you continue with what you're doing. So what I want to say is that you are nursing. It is only family situation that can prevent you from doing mental health. Mental health is good for those that are still in their childbearing age for women. Why do I say that? That is my own belief. That is what I believe. What nursing here is very flexible. Yes, if you are it's your period of childbearing, you can decide to go mental health. Even if you want to go to school, even if you want to tomorrow become an ER nurse or whatever, anywhere you want to get to, that period of time you are still bearing, doing childbearing, you can do mental health because it's not too stressful on you. When you go back home, you're still very alert to take care of your children. Look at their faces. They will look at your faces. You'll be able to do your stuff, do your wifely role, your motherly role, and every other role. It is easier for you. So what I'm saying is that once you have a good arrangement back home, you can do mental health, anybody. Yes.
Okay. Sounds good. Thank you so much. And somebody can just touch on these questions one after the other. Someone else is asking, what's the nurse-patient ratio like in mental health?
So everything depends. It depends. Like I said, I mean, I don't know when this person joined. It depending on where you are, like the setting you are. Mental health nursing is quite broad. If you are in a locked-in facility, like I said, I worked in which I still work there once in a while, I do PRN there. it is a locked-in facility, depending on the acuity. When I say acuity, there are some patients that are so demanding, they are very needy. They can be, okay, I have one unit that is 25. You can just be just you, passing meds for 25 patients and still being their nurse, but you have enough techs. Remember, these people, they don't have like physical, you know, conditions, but they have mental. They are good. They don't, majority of them, they don't have to, like, you don't have to change this person bedpan, you are passing bedpan and stuff like that. There is nothing like that. They live their normal life. They take care of their hygiene. They brush their teeth. They do things, everything. They live normal life as you are. It's just you have to watch their boundaries, their limits, what they can do and what they cannot do. You talk, redirect them, coach them, and all of that. So depending on the hospital setting. So when you go to Lockins facility, there are some areas where you might have 25 patients to one nurse and one LPN, especially at night. They know that you don't like so have so much physical interactions with this patient. Sometimes you don't have enough people on ground. So sometimes you have 20, sometimes you have 25, sometimes you have 50, sometimes you have 75, But then in the hospitals where you have like acute care setting, whereby I have had a nurse to 10, we have had a nurse to 8. We have had a nurse to 6, depending on staffing needs. In my unit where I work now, I work seniors, and so that unit you can't staff, you can't, we don't do more than 12 because they are seniors. And so at the state law, you don't do that unless you put more staff into them. So once we are more than 12, we have to be 2 nurses. So they don't staff my unit more than 12. So between 1 to 12, that is where the unit I work around the clock. So I am just the only one nurse there. You are passing your medication, you are doing the nursing, but you have the techs because they are senior. Some of them need, and then that unit only CNAs work in that unit. CNAs, because they have some of these people, you have to change diapers, you have to change position because of their age and stuff like that. So that is what it is. There are no like staffing ratio. It is dicey. It is as the staff need is. So, but that is what it is. It is doable
All
because you have
right.
support. Yes, sir.
All right, thank you so much. Thank you. We have so many questions still popping in. We'll pick and choose a few so that we can get the program to a close. We have spent close to 1 hour, 30 minutes on the show. All right. Thank you guys for being on this show. I appreciate your presence. You guys keep me going. Thank you, and thank you. So the next question, this person is asking that is there any situation that can make you be exempted from answering a code? Like, you just don't want to answer code in your hospital. Can I be excused from answering codes
Like all the time?
all
Nah,
the time?
nah. You don't have any
Eh,
skills. If you don't want to answer code, you don't have to come to work. You don't have to come to
I'm
work. You have
allergic
to
to
answer.
codes.
What?
I don't want them to beat me.
So you don't have to stay in the environment. If you're allergic to that environment, then you find another place that befits you. So, but for
Mm,
codes, you have to, unless you have an understanding, maybe you are pregnant or something, and the people you work with knows that yes, this person
mm.
is pregnant. They
Yeah, yeah,
can,
yeah.
they can understand you. If you are leaving the unit, they can ask, okay, stay behind, watch the unit as we go answer the code. You understand? So, but there is no how. If there is code pink, you'll be there. At least show your face, that you are there, just emotional support. And others that are more agile or something will be hands-on doing the needful. And then you can do documentation. As I do the blood sugar, you can be writing, you can be documenting as I do the
The-
rest. Yes.
Okay, the next question is about forensic nursing. So what was your role when you did forensic nursing?
I mean, a nurse is a nurse. There is there is no special, just you just know, you just have an idea of what these people are. They have court days, they go to court, and you expect either a positive outcome or a negative outcome. So it's not, yes, some people do forensic nursing, whereby, okay, let me give an example. Those that wants to do that. That's why I said nursing here is so broad. even in mental health, you have so many other subspecialties that you can get yourself involved in. So forensic nursing, you can just go do that nursing, go do that training or certification, whereby so okay, if a mental health patient says he was sexually harassed or was raped, it is a forensic nurse that takes the sample. They go to the hospital. It's a forensic nurse that comes in to see, they have take specimen, do their thing. That is that for them in that aspect. So in a forensic setting, you mustn't be a forensic trained nurse to work there. You just have to understand that this is what is obtainable here, and this is what is obtainable here, and knowing what to do and what not to do. So you mustn't go in to do forensic nursing for you to work in a forensic facility. Yes.
Okay. All right. Sounds good. Thank you. Then the last question is, what's the role of a mental health nurse practitioner in your unit? What do they do when they come?
Okay, so like I said, mental health is broad, and some people will just go that path and become a nurse practitioner, and people like us will not want to be in the hospital setting forever. We want to do business. You can also diversify and do other aspect of nursing related mental health centered business areas. So, but for nurse practitioners, they come in and they are like providers. They are like doctors. They prescribe. They work under, psychiatrists. They work with them, and under them, they have somebody who is the medical director, who is also a psychiatrist. And they work with them. They see patients. They come in and see patients as doctors too. Talk to this patient and do the assessment, do the mental evaluation for new admissions, and then go through their file and then do prescription. If there are needs for medication adjustment, they will do medication adjustment for this patient. And whatever the doctor does, there are just very few that they can't do as nurse practitioners, but nurse practitioners are providers. They do what the psychiatrists do too. That's what they do.
Thank you so much. I told many of you that when you come over here, you will become mental health nurse practitioner. Go and mark my word. By the
Of
time you
course.
come here now, many of you that are on this call will become mental health nurse practitioners. Okay? So
Mhm.
when you come, you start packing your money, in mental health nursing. That's when you start, seeing the provider aspect of nursing, if I may use that word. All right. So now, Ifeoma has a question. Ifeoma, I've asked you to unmute. You can unmute and ask your question, please.
Good evening.
Yeah, good evening. How are you doing?
Fine, thank you.
Yep, go
So,
ahead. Where are you calling
my
from?
question is I'm calling from KB State, Nigeria.
All right, go ahead with your question.
Okay, my question is the Nigerian psychiatric nursing license, or will I say certificate, is it regarded in the US?
Okay.
So sorry,
Go ahead, go ahead.
am I good? Okay, so yeah, honestly, what we want here in the United States, are you a registered nurse? Yes. So that one can be a plus, and it can just be a plus, I may not. So I know somebody who I know a lady that I worked with. She did psychiatric nursing in Nigeria. It's just that you just add it there as part of your stew or your rice, but you're an RN, you're an RN. Yes, yeah, they recognize that too, but it doesn't really like do anything special.
Okay.
Yes, yeah.
All right. Thank you so much. The last question that I have, did we answer your question, Ifeoma?
Yes, sir.
Okay, thank you so much. The last question that I have for you today is, when you came to the United States, I know you saw a lot of different areas of the United States, how to cope. You went through a lot, you shared some stories with us already, but want to know what helped you to kind of adapt culturally to the United States. What was the things that kind of helped you to kind of adapt? There's this thing that a lot of nurses, when they come over here, first thing they will start missing home. Before you know it, things will start going wrong. Some people, their marriage will suffer, but you've been pushing, you've been strong and pushing and helping others to cope as well. So can we know your secret, man?
Thank you very much. Honestly, This is a bold step, leaving Nigeria, leaving your loved ones, leaving the ties you've formed for yourself and coming to the United States. And I always say this, coming to the United States, you need community. And that is what Decency is building. We need a community whereby you can belong. You people are very fortunate. You're already relating, having this interaction, building this family before you get here. So what I want to say is building community around yourself, community that, like back home, some of us, like me, we came to Decency has been a super support system for me. Yes, I want to say it. We were together in National Hospital, and then he became my boss. He was teaching me. He held my hands. He told me about going through this process. I passed through with them. We worked together, and then they got to the States before me, and some other friends who came to the state before me. And then they were very super supportive. You need support. I am telling you. I told myself, once my kids start settling down in this state, I'm telling you, I'll stop working, because you need support. That is the only truth you will tell yourself. For you, no matter the opportunity in this land, if you don't have support, home support, family support, I'm telling you, are not going to succeed so good. So I had this support. Decency supported me big time. My family, they kept my family with them for a couple of months. So I was trying to find my feet. And so that is me big support. And I told myself, and somebody helped me find a job when I lost my job, you know. And I told myself I owe this responsibility, as many, whether you come through or anywhere, be a support to somebody. I told myself I am going to be a support. It is a debt I have to pay. Anybody, I have to be support in one way or the other. I have to be a support. So building a support system around yourself, that is what Decency is doing, so that you can have people that you call and say, hey, I just got here. What do I do? It may not really be finance. It can be financial support. It cannot be mental support. It can be guidance. People can guide you. I'm telling you, if you're not guided in this country, my dear, you play around the bush and fool yourself for years before you'll be able to find your path. But so why will I fool myself if I have people who can tell me the truth, who can be sincere with me in everything about work, as we are discussing it, about specialties, about how to live, where the state to start, and stuff like that. So building a community and then determination. This story. What I was working in National Hospital, and also that community too, because when we got to the state, when I lost my job, before that happened, when we met in Florida, normal thing we do back home. We started that way here too, this contribution thing. I don't know what they call it, but listen, what do you call that?
It's just rotating or revolving fund. Revolving fund, when you
Help,
say that,
whatever.
so
I did it. I am telling you, and I still do it for some people when they get here, people that I know that so when we got here, we have about 5-6 people from National Hospital. So we knew ourselves back home in Nigeria. And some of them that we are doing these things for here, I've not met them. And so when I lost my job already, 2019, we have agreed to do this, and boom, I lost my job. Already, I will be I've set out to do it, and I've already picked. Unfortunately, I was number one pick. And so when things in my roughest period here, that's community revolving fund, it helped me. A lot would have gone wrong that period, but we did that, and then I was able to find my feet. So it is still community building in any way you may think about it. Everybody back home, people relationship you kept back home will sustain you as you get to the state. So build relationship, good relationship, friends, keep your friends, because here you will need them. You need determination and to be open-minded. I was so open-minded because I know this is a foreign land. You have left home. You have nothing left back home to fall back on. And so you have to be open-minded. No matter the situation, you tell yourself, I am going to succeed. I am going to walk through this situation no matter what it is. You may be crying and you are still pushing. Like I said, then when I have to drive 2 hours. I have never driven that much. In rains, whereby you see some big trucks, overtake you and all of that. I was so afraid. But yet, I have to do the driving. And that is how it is. So you have to be open-minded. You have to resolve that I have come this far, not to fail, but to succeed. And I'm telling you, you're going to succeed. Yeah.
That's amazing. Thank you so much. Thank you so much. I hope you guys are taking it in. All the things that she's been saying, I hope you're taking it in. These are words on marble. You cannot get it anywhere than from the vendor of good news in this place every Friday. So if you come here every Friday, there is something for you. There is something for you. So we gradually coming to the point where we're going to have a roundtable discussion. So to let you know, Ms. Ogonna, we've been going around all the specialties. So today is mental health, and our plan is that sometime in June, we will gather everybody together and we can do a roundtable discussion of all the specialties in nursing in the United States. And, we'll just explore, everybody will just talk about their specialty together in a forum like this. So I hope that when we set out to do that you'll be available for us. It's going to be on a Friday. We don't know which Friday yet, but we're going to let you know on time so that you can make plan to be on the program. But want to appreciate you for coming here today. Thank you so much for all that you have explained to us. A lot of people have gained from what you explained. So guys, if you really got value from what you learned here today, I would like you to type value on the comment section. Type value on the comment section, guys. I would like you to type value on the comment section. So thank you. So our next next Friday topic is going to be, we're doing pediatric nursing. So we're going to get someone who is on the pediatric side of nursing to come here and tell us everything about pediatric nursing in the United States. So if you want to learn about pediatric nursing, come next Friday, come here. We're going to be discussing it on this forum. Okay, thank you for all the people that have written value on the comment section. All right, and then if you're looking to a place for you to do your NCLEX, both the review and registration, we've sent our flyers on the comment section. You can go through the comment section, pick our number there, and then call us. You can chat us on WhatsApp. You can send us an email. We'll be more than happy to assist you as well, to help you to go through your NCLEX and IELTS or PTE, whatever course that you want to write, will help you to do that. And then not to forget, we have a program for those that are trying to become nurses that work from home in the United States. That's clinical documentation improvement practitioner, great practice. If you want to get into that space, we'll have a program coming up. I'm not sure when I gave them, but it should be that this week or next week. I will also send out information about that program if you are looking in that direction as well. So thank you, guys. So there's something that we always do when we come to the end of the program. We're going to say thank you in our own languages. So I would like to hear from you. I would like you to speak your language. So if you speak your language, let us know which country is coming from. Okay, so say thank you in your language and let me know which language it is. Please, Mabel, which language is saying Akbe? Please put it together. You can put Akbe and then tell me which country is coming from. All right, I want us to learn languages, and that's one of the things we'll learn at the end of the meeting, because we have so many people. We have Gambia, we have Kenya, we have so many people. So which one is Dalo? Dalo is coming from which country? Please put the country beside your thank you. Put the country beside your thank you so that we will know where it's coming from. So if I'm passing through your country, if I come down from the plane, I can easily speak your language and say thank you to people in the airport, and they will think I'm one of them. Please kindly let me know the language you are telling us. Okay, thank you so much. Thank you. Thank you, Madasi. Yes, Ghana. Thank you, Baraka, Gambia. Thank you, Madasi. Thank you. So Ghana has two languages. I need to be educated on this one. It's now becoming confusing. All right, so Uganda, Wambela, Inyo, Sebo. Thank you. Yes, I'm learning. So Dewo Isoko from Nigeria. Okay, now Dewo, okay. And then Wabella Iyo Sebo from Ghana. If I'm not getting it correct, one day we're going to say it with our voices on this meeting, so I'll know how you actually pronounce some of those thank yous. But all these things we are doing is to let you know, Mr. Ogonna, that we are so happy and grateful that you came for this meeting. Thank you so much for joining us. A lot of people who are here has been on, retrogression. We've been waiting on ID. We've had trickles of good news, but not as we want. People have been getting visa appointments, but not as many as we have. We are more than 1,000 in our EPG, exclusive pre-arrival right now, and everybody is anxiously waiting for that time when they can get their ID. So I know you may have like a final word, so like something to just say in respect to the waiting period. Yeah, I have somebody from Zambia. Zambia said Natotela Bemba from Zambia. And I think I got it. Natotela. Yes, I got that one. Come on. I'm the chief of all languages. All right. Yeah, thank you so much. Thank you. So if you have a final word for us, especially in this waiting period, we would like to hear, okay, before we call it a day on this show. Okay, guys, let's all listen to the final word from our guest.
All right. Thank you very much once again for your time. Honestly, wherever you find yourself, whatever you're doing back home where you are, I am telling you, it is a preparation ground, and no waiting period is a waste if you keep doing something. So like when we go here and back home, sometimes decency knows when in the theater, in the operating room, you may be on call for 24 hours. And sometimes we grumble about it, we complain. You don't know you were building stamina. Stamina was built back home. Whatever you see today that we are enjoying, it was stamina that was built back home. Stamina, determination, all of these things were built back home. You don't know this waiting period is just for you to get a little more preparation. Okay, if you had some of this information, some people that moved immediately didn't have it, and when they came, they were playing from doing pillar to post until they find their feet. Or now that we are doing this in your waiting period, it is a time you are bridging gaps. You are bridging gaps because once you get to the state, you know what you want and you jump into it. So what am I trying to say? That whatever you are passing through, this waiting period is not, don't just say it's a waste of time. It is not. So many people who jumped in here, wasted a lot of time in here, and they pay the price in a bad way. So I want to encourage you. Do not give up this waiting period. Get your hands, do something, learn skills. Let your partners, let your children learn skills too, so that once the door opens, because it's eventually is going to open. This door is going to open, and there will be a floor. You will come in and get doing. So that now, when some people will see us do 12 hours, do 16 hours. We do 16 hours. And people sometimes they will look at me and say, hey, Ogonna, are you a human being? How do you do this? And some people will want to say, okay, let's do because Ogonna is doing. And they will break down because they don't have this stamina. The staminas we are built back home. So what am I trying to tell you? You are in the making. You are building the muscle. You are in the gym. You are building the muscle. So that once you hit the field, you keep running. So I want to say, do not be discouraged. Just be positive about the whole thing because the dial is cast. You are already ready to start running. It's just you are waiting for the whistle for them to blow the whistle. So what am I trying to say? You, your spouse, your kids that are grown should get skills. Even the younger ones get skills. Once you go to the United States, you'll be able to fit in very smoothly without so much delays anymore or hindrances. So I want to encourage you that you should not give up this hope. Do not give up this hope. Build one or two staminas, things that you need. Brush up yourself. Get yourself ready for the real thing. Very soon, sooner than you expected, it will happen. And you will be happy that this waiting period was not in vain. This is my word for you today. And I'm telling you, it will come to pass for you. That was our prayers and it happened for us. We are telling you it's going to happen for you by the grace of God. Thank you very much.
Man, thank you. What a lovely session. This is a lovely session. If you missed any part of this session, go to the YouTube in the next couple of hours. You would see this meeting uploaded. You can watch it there. You can gain from it. You can watch it free of charge. You don't need to pay for it. Okay, so you can go there and watch it. Click subscribe and then click the notification button so that when next we have another upload, you will get a notification on your own phone or email. So thank you so much. Thank you, thank you, thank you. I don't even know how to thank you enough for, coming here today and for, all the things that you said, which are very, very useful information. I think it was an informative session. Yes, our YouTube handle was posted just a while ago. Beatrice, if you scroll up, you will see our YouTube handle. And if you also go to YouTube and just type Decency Academy, you will see us pop up. You will see some of our previous recording as well. You can listen to them if you may. Thank you so much, everyone. God bless you. This has been an interesting, opportunity for us to hear from Ogonna Ogochukwu. She has actually told us a lot about her, coming to the US, all the experiences. She told us about her field, what she's doing currently. And I want to thank her for being so frank. Some people will come here and maybe they will try to hide some truth, but she was as plain as a white paper. She had something that was not good happen to her when she came into the United States. She did not hide it from you guys. The best way to train a child is to let a child know that there are ups and downs in life. Because if you don't train a child to tell the child that there are ups and downs, by the day that you will not be around and the child meets an obstacle, the person is going to run away because he's never been used to it. You've never heard of it. You've never experienced it. You don't know it's going to come. So sometimes, even though we are praying and hoping that those things don't come, sometimes they do come. But just like Ogonna, do not give up. Keep pushing. Do not say because the doors are closed, hey, I'll cry for 2 days before I get myself. No. Some people will go and, soak themselves in their, tears and keep on crying. Oh, why did I lose it? Do I really belong here? No, you don't have to. You left everything back home and came here. So you have to fight. And then you get to where you belong. I tell you, Ms. Ogonna has actually gone far away from that story. She has gone far. She's actually a big-time businesswoman now. I'm going to invite her on another different level to explain all the other things that she's doing. And she's also setting the ground for her children. I know so many things about her that I'm not going to, keep saying today, but she has gone far away from the story that she said. And I think I want to thank you for your frankness. Thank you for, being able to explain that to us, tell us about it, because it has encouraged us that even if we meet obstacle, we should be able to still push forward. So thank you and God bless you. I want to thank everyone that was on this show. Thank you. God bless you and see you all next week, Friday. God bless you all. Bye.